one of the famous orthopedic surgeons in Mumbai and across India. He specializes in spine and joint replacement surgery. He has dealt with more than 10,000 surgeries and has rich experience of 36 years. He has also worked in various hospitals in UK for super specialization in spine surgery and joint replacement. Let's know more about total knee replacement. Let's discuss what are the causes of total knee replacement.
Let me tell you what knee replacement surgery is all about. The most common reason for doing the knee replacement surgery is pain in the knee. And the most common reason for pain is arthritis. Arthritis is basically the joint surface gets worn out as the age progresses. Let me tell you what the arthritis is in short. The joint surface is covered with a cartilage which is very soft, and that covers both the joint surfaces. And as the age progresses, this surface of the joint, like you see here, gets worn out and the bone is exposed. Now when the bone is exposed and then you start walking, you get severe pain, like climbing stairs, walking becomes difficult. For this, the common causes are age. As the age progresses, the cartilage wears out without any particular disease, and the most common joint to get affected is knee. It happens most commonly after the age of 60, and the problem can arise even at the younger age like 45, particularly in cases of obesity, as the weight distribution on the knee becomes increasingly more. The other causes of arthritis in the knee are rheumatoid arthritis, which is commonly called as VAT, then tumors, infection, and tuberculosis. For these reasons also, joint replacement surgery may be required.
Now let's know more about the procedure of total knee replacement.
So once you decide about the knee replacement surgery, there are certain investigations which are done. The most common is the X-ray. A special X-ray is required before we do the surgery to check the wear and tear. Then depending on the cause, we may do certain investigations like X-rays before surgery. In certain situations, CT scan or MRI may be done before surgery. Other tests are like blood test, urine test, ECG, X-ray. All these things are done for the fitness before surgery. Once the fitness for the surgery is already done, then the surgery is planned. In the knee replacement surgery, what you have is a worn out cartilage on both the surfaces, that is the upper bone, femur, and the lower bone. So what we do now is we remove a part of the only 9 mm of bone from the top bone and only 2 mm of bone from the bottom bone. So once we remove the 9 mm of bone, we see a surface like this. So we see a cut surface in different directions, and on top of that, a special implant which is available in different sizes is put on the top of this, which fits your bone. So this becomes your femur, or that's the upper bone. Similarly, you have a cut surface. Similarly, we cut the lower portion of the bone also, and we have a special plate of different sizes that fits you, which goes on the top of this. So this becomes your new knee.
There are some frequently asked questions by the patients that will surely clear your doubts.
The most common questions asked by the patient is, am I old enough to go for the surgery, or I'm too old for the surgery? This is the most common question. The patients, sometimes we have operated patients at the age of even 25 for certain tumors or infections, etc. And we have done knee replacement for patients who are even 92-year-olds because they are fit and energetic. So age is never a factor for joint replacement surgery, provided joint replacement surgery. If you are having a significant disability or if you are not able to walk, you need to have a normal lifestyle, and for which age is not a factor. If you are fit, you can undergo the procedure. Patients ask about pain, how much pain I will get after the procedure, and they are very fearful of this particular thought. So now with the newer technologies, we give a lot of local injections and painkillers even during surgery, and after surgery the pain can be controlled with modern medicines. So most of the patients now feel very comfortable and are able to walk even next day, and within 48 hours patients are able to go home with few painkiller tablets with them. The pain is very nicely controlled now with modern medicines and techniques. A lot of people are fearful that after surgery I will not be able to walk, not able to climb stairs. So let me tell you, after surgery, you will be able to get much more activity like walking, stairs, climbing, even sports like golf and swimming, cycling, all that is possible after surgery. People whom I have operated even 17 years ago are doing Bharatanatyam properly and able to have a very active and fruitful life.
Am I too old for the surgery? At our hospital, we have done knee replacement surgeries from the age of 21 to 90 years old for various problems of knee joint. If the person is medically fit and unable to walk because of knee pain, knee replacement surgery should be considered. Am I too overweight for surgery? No, though the normal weight is desired, but surgery can be done in overweight patients as well. After how many days I can start walking? Patient is made to stand next day after the surgery with the help of support, and gradually the patient can start walking. How long physiotherapy will be required? For faster recovery, 1 month of physiotherapy is required. After how many days will I get discharged? Generally within 3 to 4 days after the surgery, the patient can go home. When can I resume my activities? If the patient is fit enough, then within 6 to 8 weeks, they can resume all the activities without any support. How long will the inserted implants last in the body? With the advanced implant design and materials, more than 90% patients have successful outcome of 20 years after surgery. But now with new materials like oxonium, the implant can last up to 30 years. TKR gives good functionality in terms of daily activities like crossed leg sitting, stairs climbing, etc. This patient was operated for TKR 20 years ago. Even now she is able to dance and has one of the biggest Bharatanatyam dance classes in Mumbai. Age is not an issue anymore. This patient is 89 years old and walking independently. Any operation needs proper care and rehabilitation. Let's know more about how you should take care of yourself. Avoid crossed leg sitting for 3 months. Avoid floor, low chair sitting. Avoid jumping and running. Use high commode extension. Testimony of total knee replacement.
मैं डॉक्टर उषा त्रिवेदी, आई एम 78 ईयर्स। मुझे 7-8 साल पहले नी जॉइंट में प्रॉब्लम हुआ। मैं खड़ी नहीं रह सकती थी ज़्यादा टाइम और चल नहीं सकती थी। चलने के टाइम लिम्प आती थी। तो डॉक्टर विनोद के पास में आई, उसने मुझे फिजियो और ट्रीटमेंट दिया 2-3 महीना। फिर बोला कि इट इज़ नॉट रिएक्टिंग, सो बेटर वी विल गो फॉर TKR, टोटल नी रिप्लेसमेंट। तो उसने मुझे 7-8 साल पहले एक नी जॉइंट में नी रिप्लेसमेंट किया। देर आफ्टर आई हैड सम पेन फॉर अ मंथ ओनली and then I was all right. Up till now I don't have any problem और मुझे चलने में कोई तकलीफ़ नहीं है, उठने बैठने में भी कोई तकलीफ़ नहीं है। डॉक्टर विनोद is an excellent surgeon. His surgery is superb and we are very much relaxed and happy with his surgery.
Yes, knee replacement can change your life completely. The surgery is always one step towards no pain journey. Dr. Vinod Agrawal and his well-equipped hospital is always there with you in entire process. Then let's come together and conquer this hurdle and face the new normal phase of your life.